I'd like to offer a little bit of an introduction to the topic and to myself as a teacher here. I will be talking about relational approaches to here and now experience, but also covering a bit about a cultural focus, a somatic focus, and a depth imaginal focus. And what I like to do when I'm starting any class is to just offer kind of my positionality and to note that, really anytime we're doing anything, we're always coming from our particular social location and our various different identities and all the history and power privilege dynamics that come with that. And as a white man, there's certain considerations that I really try to hold to, which is to work to decenter the whiteness that can infuse, especially teaching situations where white experience gets centered. So I would invite any feedback about my presentation if it does miss certain aspects of difference. I want to encourage this to be a group experience. So if there are certain things that I miss or certain things that I say that feel overly generalized or kind of slip into that dynamic of centering whiteness or male experience, feel free to chime in and we can make that part of the kind of emergent learning process. Um, so with that, I'll go ahead and move forward into the topic itself. I'm going to use some slides, but I'll go back and forth between the slides and bringing you back on screen so I can have a relationship with you as we're going along. There tends to be a pattern in most of us to skew towards talking about ourselves in an abstract sense. And all of that's useful for creating a cohesive narrative for our life, to tell the story of our lives, even recent experience. Um, However, if we think about how change happens, um, I would say that the bulk of change happens when we're in a more kind of experientially focused mode of relating to ourselves and the person that we're talking to. And so what I mean by experientially focused is something like what we were just doing, like a kind of present, open awareness to what unfolds as we're speaking. And in doing that, we have an opportunity to see our patterns show up in real time, where we can actually shift them or change them or have what we might call a reparative or corrective emotional experience. So um, I would also associate here and now with the quality of aliveness. And one of the ways I could frame the entire aim of psychotherapy, and including psychedelic therapy, is to really enhance that quality of aliveness. Here I'll begin to talk about integral dimensions of the therapeutic process. And this is really what I would consider the kind of core foundational aspects of an integral approach in psychedelic therapy. So the first bullet point I name here is cultural. We could also call this a social justice focus or a liberation therapeutic focus, which is really a kind of shorthand for saying there is such a deep interpenetration between our experience as cultural beings and our experience as psychological beings. Um, the identities that we hold, the cultural experience that we have, the environments that we live in, and the dynamics of power, privilege, oppression, and liberation are key components in what really shapes the psyche. Um, in terms of working in the here and now with cultural dimensions, this is a key aspect to how I work, and I want to just name this before going forward into a more specific focus on relational dynamics that can be worked with in a present moment focus. Um, because the two are so deeply related, that our relational experience of ourselves and our therapists, um, how we experience ourselves in relationship and how we experience the other in relationship is deeply shaped by the identities that we hold. And moreover, a relational approach really hinges on the quality of safety, and the quality of being seen and understood that we anticipate from our therapists. And part of what I emphasize in this dimension is really right from the start being very transparent about who I am and the kind of cultural background that I bring in as a psychotherapist. And I do that because the things that I say, the understandings that I come to as client-centered as I aspire to be, will be skewed by the particular cultural experience that I have had. And so I want my clients to know that I'm tracking that from the beginning and that I'm willing to hold a kind of cultural humility around dynamics that will inevitably unfold or misses that will inevitably happen as we work across difference in the therapeutic relationship. Um, so right from the beginning, I want to draw my clients in around talking about how it feels, for example, with me to be sitting across from a white therapist. And this is not just with BIPOC clients. This is something that I try to bring in with all my clients. Um, there are dynamics that unfold between two white people that are also important to name. One of those dynamics is what I'll call psychic numbing, which is something that I think is a very important notion for any psychotherapist to hold, and which is quite common, especially when we hold multiple dominant identities. So psychic numbing involves a kind of lack of responsivity or awareness around cultural dynamics, and issues of power, privilege, oppression, and liberation. The second focus that I hold as part of an integral whole is the depth dimension. And I consider this the kind of vertical axis of experience, the capacity for the psyche to descend into what I might call underworld consciousness, or descent for the sake of ascent, dropping further into our experience of our history, our wounding, the death rebirth process, and the whole kind of underworld of the archetypal imaginal world that really shapes so much of our psyche. The other end of the vertical axis is ascension, is the transcendent and the transpersonal. And in psychedelic therapy, as you all know, there's kind of really unprecedented opportunity to experience the transpersonal, enter into the psychotherapy frame. So in terms of working with that in the here and now, I really try to listen to my clients from that imaginal archetypal perspective, listening for the way their everyday speech discloses images in the language that they use. And it's just a simple little kind of turn of language to bring out the underworld of the words that we use, the hidden kind of entendre or metaphorical symbolic dimension of even descriptions of our day-to-day life. So what I can say here is that doors to the underworld, or portals to the underworld, are abundant, and it's just a matter of listening for them, and offering a little bit of a reflection and a curiosity back to our clients to begin to make that descent or ascent. The third component that I'll name here is the relational, and this will be a central focus throughout the rest of the time, as I mentioned. So what I mean by relational are the dynamics that inevitably unfold between client and therapist. We call that enactment or transference, countertransference. Um, it's also how we feel in relation to our therapist as a real person. So it's not all projection, right? We're also, in many ways, relating to the real person that's right there. And so here we can take in considerations around the quality of safety or unsafety that we feel in any given moment with our therapist. And lastly, I'll name the somatic or trauma-informed approach that is also such a key component in psychedelic therapy. So this doesn't need much explanation. Our body is always in the here and now, and the gestures that we make, the tone of voice that we have, the indications of nervous system dysregulation or regulation are always right there. Um, and so tending to those and helping the client to learn to track those is really central to how I work, and I imagine how many of us work. So let me go ahead and now begin to focus us in on relational approaches. And I'm not going to spend too long in theory, because I do imagine many of you know some of these core theories. What I'd like to do for the rest of the time is to just briefly define transference, which I'll do in the next slide. And from there, I'll go into maybe 3 or 4 little vignettes, examples that will give you a sense of what I mean by transference and also how I responded in these situations. Um, and I'll try to weave in the 4 dimensions that I've just named um, through the relational lens that I'll be taking up. After that, if my time management is good enough, I'd like to do a brief demo session. And so I want to just name that here and now. Here and now. Okay, I'm going to be punning on that probably. I want to name that now so that you all can just feel into whether any of you would like to be the client for me to offer a demo. And that can go one of 2 ways or a combination of the two. You could just simply be yourself if you feel comfortable doing that in this setting, and share what you'd like to share from your lived experience and relate to me from, who you are in real life. The second way of doing it is if you think of a client that you've had some struggle working with in the here and now, and you'd like a little bit of assistance around that, both through how I might work with you, but also through the debrief. I'm not going to in any way presume that I'm going to demonstrate this perfectly. There will be mistakes that I make or moves that I make that maybe misses that other people would want to do differently. So I offer the demo session really just to give us something kind of live, again, here and now to work with and to debrief around. So you can take up a kind of client, especially if you're good at method acting and kind of really can feel into the emotional reality of that client's life. And there's actually a third option of a hybrid between the two. You can take up some aspects of a client's presentation and then also weave in parts of your own lived experience or real responses to me in the moment, without us even actually knowing what's a client and what's you. So that's how I'd like to position this. And if nobody wants to volunteer, that's fine too. I can really work off of case examples and give you um, more of that material. All right. So let's go ahead and dive into the notion of transference. So a kind of general definition of transference is it's a projection of feelings, desires, and patterns of relating. And I put in parentheses here that are derived from early development. And this is not often talked about, it's not just early development, but it's also our cultural environment. And this is that social aspect that I was referencing. So again, taking myself as an example, there are certain feelings that people are going to have just seeing the tone of my skin or the sound of my voice and the way my body is constructed, the way I present as male, um, and cisgender male. So we could call that a cultural transference, that people's experience of white men is going to be right here in the field between us. And so again, that's something that I really I try to create a culture between myself and the client where those kinds of experiences can be named explicitly and worked with. Um, just as we attempt to work with transference to heal developmental trauma, we can work with cultural transference to heal cultural trauma, and to establish more safety in the therapeutic relationship. A second bullet point that I'll highlight here is that transference is a dynamic process. It shifts as I call it participant here, a client, patient, participant changes states or parts. That no transference is ever just consistent throughout even any given session. It can change moment to moment. Transference is not all maternal or paternal transference. You can have a transference to a therapist that, let's see, what's an example? A transference as a friend. Like you may feel like your therapist is your friend that you're talking to. A third bullet point down that I want to touch on is that transference is not just backward looking. This was a contribution that Jung contributed to the field, which I really appreciate and is very important for psychedelic therapy, um, also therapy in general. That transference is also forward looking. We could call it an expression of the inner healing intelligence, that we not only project templates from our early developmental wounding and our cultural wounding, we also project out aspects of self that we're attempting to grow into, that we're attempting to integrate. And that's what I mean by forward looking. It's a way of other people holding for us aspects of ourselves that we aspire towards or that are latent or nascent in our psyche. So here's a little quote. Transference is an opportunity to foster a meaningful relationship with the as yet unknown psychic content and to transform the image into new forms that can be integrated into the personality to balance the conscious attitude of the ego. I'm not sure more needs to be said there, so I'll just go on to this next piece. A very important distinction is that not all perceptions from the client are transference. We also have to hold in mind that our clients may be reacting to very real aspects of what we're bringing. So along with kind of holding that lens of what's being transferred onto me, it's very important to also hold what am I contributing here. Transference does not happen in a vacuum, in other words, that there are real things that about us that our clients are reacting to all of the time. The meaning that they make of that is, idiosyncratic to them. It's always going to be theirs, but it's also important not just to put everything on the client, right? There's a need to look at oneself continuously, and I would argue even bring oneself in, and to name in a kind of transparent fashion what we're noticing about the way that we're relating to our clients.